Ever get the feeling that sometimes an illness is more than just a quick bug? Something that lingers and throws a wrench in the works?
Yeah,
Well,
yeah,
that's exactly what we're diving into today.
yeah.
The long-term ripple effects of long COVID.
Okay.
It's not just a personal health thing.
Yeah.
It has the potential to seriously impact healthcare systems.
Well,
And,
yeah,
even our wallets.
it really does.
It's a big deal.
It's fascinating, isn't it? We're years past the peak of the pandemic now,
Right.
but long COVID is emerging as this major societal challenge.
Yeah.
Even the Washington Post editorial board is sounding the alarm about its potential to impact disability,
Yeah, I saw that.
which is pretty significant when you think about it.
It is. And CNN even ran a piece comparing the disability burden of long COVID to heart disease and cancer.
Wow.
And get this,
Right.
long COVID is actually heavier.
Really?
Right.
Yeah, that's wild.
Kind of wake-up call, don't you think?
Absolutely. It really highlights the need to understand the sheer scale of this issue.
Yeah.
And that's where this UK study comes in.
Okay.
Published in the Journal of the Royal Society of Medicine.
Okay.
They tracked a huge number of people,
Okay.
282,080 individuals
Wow.
with long COVID for a full 2 years.
2 years.
Yeah, that's impressive.
That's dedication.
Yeah.
Okay. Before we dive into the nitty-gritty, I have to share this quick story.
But
I recently met someone
yeah.
who's been dealing with long COVID for months.
Oh, wow.
And it's completely turned their life upside down.
Oh, no.
Doctor's appointments constantly.
Right.
Struggling to work the whole deal.
Yeah.
It really hit home for me
Yeah.
how disruptive this can be.
And sadly, that experience is not unique at all.
Yeah.
This study was incredibly thorough,
Okay.
using 4 control groups
Okay.
to compare long COVID patients to those who recovered from COVID without long-term effects.
Got it.
A pre-pandemic group,
Okay.
a pandemic group without COVID,
Makes sense.
and even the same long COVID individuals, but before they got sick.
Oh, wow. So like their own baseline.
Exactly. It let researchers really pinpoint the specific impact of long COVID on healthcare.
Okay, so let's unpack those findings.
Through
What
now.
surprised you most?
Well, the core finding
Yeah.
that long COVID is associated with way higher healthcare use across the board
Right.
wasn't totally unexpected,
Yeah.
but the sheer size of the difference
Okay.
was definitely eye-opening.
Like how much higher are we talking?
For instance, they found long COVID patients had almost 10 GP consultations per year.
10.
Yeah, compared to just 3 to 7 for the control groups.
Wow, that's a huge jump.
It is.
What do you think is driving such a big increase in GP visits specifically?
That's a great question.
Yeah?
Part of it might be the lack of clear diagnostic criteria for long COVID.
Right.
It can present with over 200 symptoms,
Oh, wow.
like that Bulge Financial Consulting article pointed out.
Okay.
And there isn't just one single test
Right.
to confirm it.
So you're going back and forth,
Yeah, you're going back and forth a lot.
trying to figure out what's going on.
Exactly.
Okay.
And the study found that this increased healthcare use,
Yeah.
it wasn't just a temporary blip.
Oh, really?
Yeah, it persisted
Huh.
for the entire 2-year study period.
Wow.
You can actually see this very clearly in Figure 3 of the report.
So we're talking about a sustained impact
Absolutely.
on the healthcare system.
Yeah.
Okay, but what does this actually look like on the ground?
Okay, imagine this.
Okay.
You go to your doctor's office,
Yeah.
and the waiting room is packed.
Oh, no.
You wait longer for your appointment,
Oh.
and maybe your doctor seems rushed
Right.
because they're trying to see so many patients.
Oh.
This is what increased healthcare utilization can mean.
Okay.
Longer wait times,
Yeah.
strained resources,
Right.
and potential delays in care for everyone,
Oh, wow.
not just those with long COVID.
That's a scary thought.
That is.
I haven't personally experienced significantly longer wait times, but I can see how that would be a very real consequence.
Especially in areas with fewer healthcare providers.
Right.
Yeah.
And of course, we can't forget about the cost
Yeah, the financial burden.
of all those extra doctor visits and tests.
Absolutely.
It must be adding up quickly.
You're right.
Yeah.
The study found that the cost of long COVID care
Yeah.
was over £700 per person per year.
Per year.
Uh-huh.
That's a lot.
Which is almost 2.5 times higher than before the pandemic.
Wow.
And remember, this is just in the UK.
Right.
Costs in the US
Yeah.
are likely even higher.
Yikes. And it's not just the healthcare system that's taking a hit.
No.
That Welch Financial Consulting article
Right.
also mentioned a potential wave of disability claims
Yes.
stemming from long COVID.
Exactly.
If people can't work because of this,
Yeah.
that has a huge impact on individuals and the economy as a whole.
Absolutely.
It's a big deal.
Think about the impact on your personal finances.
Right.
If you were suddenly unable to work
Oh, yeah.
due to long COVID,
No one thinks about that.
we're talking about potentially years of lost income,
Yeah.
not just a few weeks of sick leave.
That's scary.
It is a sobering thought,
Yeah.
and it's something many people are already facing.
Yeah.
Remember that CNN article we mentioned?
Yeah.
It estimated that 2 to 4 million Americans
Yeah. Wow.
are already out of work because of long COVID.
That's a huge number.
It is.
And it really drives home that this isn't just a medical issue. It's
Yeah.
a societal issue.
Yes, with far-reaching consequences.
It really is.
While the financial cost is significant,
Yeah.
it's important to remember that the human cost is even greater.
Yeah.
Behind these statistics are real people
Right.
whose lives have been drastically changed by
Yeah.
long COVID.
Yeah.
And it seems that the struggle is especially intense
Okay.
in those early stages.
Oh, really?
The study found that most of the healthcare burden
Yeah.
happens
Okay.
in the first 2 months after diagnosis.
I can imagine that must be a terrifying time.
Oh, absolutely.
You're trying to figure out what's wrong,
Right.
navigating a healthcare system
Yeah.
that's still figuring out how to treat long COVID.
It is.
And on top of that, you're dealing with this intense burden of illness.
It's a perfect storm,
Yeah.
and it really highlights the need
Yeah.
for more research and support
Yeah.
for those with long COVID.
It makes sense.
It's not just about managing symptoms.
Right.
It's about providing comprehensive care
Right.
that addresses the physical, emotional, and financial challenges
Yeah.
of this very complex condition.
And that complexity is a key theme that runs through all of our sources.
Definitely.
We've got over 200 symptoms,
It's a lot.
no single test for diagnosis,
Right.
and no cure.
Nope.
It's no wonder so many patients struggle to even get their condition recognized
Yeah.
as a legitimate disability.
It's true. Like that Welch article pointed out.
Yeah.
It's a tough situation.
It's a real catch-22.
It is.
Many of the main symptoms of long COVID,
Right.
like fatigue, brain fog, and pain,
Yeah,
those are subjective,
they are.
making it hard to prove your illness in
Oh.
a system that often demands objective evidence.
Exactly.
Which brings us to that winning long COVID disability claims article.
Yeah,
It's like a survival guide
it is.
for
and-
dealing with this tricky situation.
Yeah.
It really stresses
Yeah.
having thorough documentation
Yes.
and solid medical backing to support your claim.
Absolutely, especially when dealing with these subjective symptoms.
Yeah, so it's not just about feeling bad.
No.
It's about proving it in a way that the system recognizes.
Right.
And that sounds really tough,
It can be.
especially when you're already dealing with all these symptoms.
Exactly.
It's like a double whammy.
It is. And that's why having strong medical evidence
Yeah.
is absolutely crucial.
So when we come back, we'll talk more about
Yeah.
how to build that strong medical case. And we'll delve deeper into the challenges of actually navigating disability claims.
Sounds good.
So stay tuned. So before the break, we were talking about the challenges of proving disability
Yeah.
due to long COVID.
Right.
And that winning long COVID disability claims article
Yeah.
really stressed the importance
Yeah.
of seeking care from specialists
Yes.
who really get this condition.
It's so important.
It can't just be your regular doctor saying,
Right.
yep, they're tired all the time.
Exactly. It needs to go beyond that.
Right.
The article really emphasizes
Okay.
the importance of multidisciplinary care.
What does that mean?
So that means doctors from different specialties
Okay.
working together
Okay.
to assess and document your symptoms.
It's like needing a whole detective team
That's a great analogy.
on your case.
Yeah, they're piecing together the puzzle.
Yeah.
Your symptoms.
To build a comprehensive picture
Exactly.
of how long COVID is affecting you.
Yeah.
And it sounds like being your own health advocate.
Is really key here.
Oh, absolutely.
The article suggests keeping a detailed symptom diary
Yes.
to track the progression
Uh-huh.
and impact of long COVID.
It's so empowering
It is.
to take your health into your own hands like that.
Yeah. What stands out to you
Mm.
as the most valuable part of that?
I think it brings a level of objectivity to something that can feel very subjective.
Okay.
You know, fatigue, brain fog, pain,
Wow.
these are things other people can't see.
Right.
And it can be really hard to describe their true impact.
Sure.
A diary gives you those concrete data points
Okay.
that you can share with your doctors
Yeah.
and, if needed,
Yeah.
use as evidence
Right.
for disability claims.
It's like giving a
It
voice
is.
to those invisible symptoms.
Exactly. And that voice can be so important when
Yeah.
you're navigating a system that relies
Right.
on that concrete proof.
Sadly, this winning long COVID disability claims article.
Makes it clear that this system can be so complex
It is.
and even frustrating.
It's true. I found it quite discouraging, to be honest.
I can imagine having to fight for recognition when you're already struggling
It's hard.
with this debilitating condition.
It feels like an uphill battle, for sure.
Yeah, the article seems to suggest that having an advocate on your side is essential.
Oh, it's not just essential.
Hmm.
It can be a game changer.
Okay.
Whether it's a family member,
Right.
close friend,
Okay.
or legal professional.
Okay.
Having someone who understands the system
Yeah.
and can fight for your rights
Right.
can alleviate so much stress.
That makes sense.
And make sure you're not getting lost in the process.
It's like having a guide through a bureaucratic jungle.
It really is.
So if we zoom out a bit,
Okay.
where does all of this leave us?
That's the million-dollar question, isn't it?
It is.
There are no easy answers.
Yeah.
But what we do know is that long COVID isn't going away. Its impact is only going to grow
Right.
if we don't address it.
Okay.
More research is really needed
Yeah.
to figure out the causes
Okay.
and develop effective treatments.
And in the meantime,
Yeah.
we need to make sure that people with long COVID
Yes.
aren't left behind.
Absolutely.
You need to make sure they're getting the support they need.
It's a matter of basic human dignity.
It is.
This isn't just about healthcare.
Right.
It's about social justice. We
Okay.
need to make sure
Yeah.
that people with long COVID
Right.
aren't pushed to the margins,
Right. Yeah.
unable to work,
Yeah.
unable to access care,
Right.
struggling to make ends meet.
It's about creating a safety net
It is.
for those who are unexpectedly falling through the cracks.
Exactly.
So what can our listeners do?
Mm.
What role can individuals play in all of this?
There's several things.
Okay.
First, if you are experiencing long COVID symptoms,
Okay.
seek medical attention.
Okay.
Don't be afraid to advocate for yourself.
Yeah.
Find doctors who specialize in long COVID
Right.
and are willing to listen.
Yeah.
Keep that detailed symptom diary
Okay.
we talked about.
Yeah.
Gather as much evidence as possible
Right.
to support your case.
Okay.
And if you're facing a disability claim,
Yeah.
seriously, consider
All right.
seeking legal counsel.
Okay.
Don't try to navigate this complex system alone.
Especially when you're not feeling well.
It's a lot to take on.
Yeah, it sounds like being proactive
Yes.
and informed is key here.
It is, especially in situations
Yeah,
where clear answers
Right.
are still emerging.
exactly. Knowledge is power.
Absolutely.
But for those who aren't personally affected by long COVID, there's still a role to play.
There is a huge role to play.
Raising awareness,
Yes.
challenging stigma,
Uh-huh.
and pushing for more research and resources.
Those are all critical actions we can take.
So it's about moving beyond awareness
It is.
and taking action to support those affected
Let's
and
stop.
push for systemic change.
Precisely talk to your friends and family.
Okay.
Share information on social media.
Oh,
Contact your elected officials
okay.
and demand that long COVID is taken seriously.
Yeah.
This is a societal problem,
It is.
and it requires a societal response.
So we need everyone on board.
We do.
What I'm hearing is that understanding the scope of long COVID
Yes,
is only the first step.
it is.
The real work lies in turning that knowledge
Right.
into action,
Yeah.
advocating for those struggling,
Uh-huh.
and pushing for a more robust
Yeah.
and compassionate response.
Absolutely. Knowledge without action is just information. It's only when we apply what we know,
Right.
when we mobilize and advocate for change,
Yeah.
that we can really make a difference.
Right. And that's what this deep dive is all about.
It is. We're equipping you, the listener,
Yeah.
with the information and the push
Yeah.
to be a part of the solution.
It's about empowering each individual to be a force for change. Well said. We're approaching the end of our deep dive.
Okay.
But before we wrap up,
Yeah.
I want to take a moment to reflect on personal stories
Yes.
behind all of this data.
That's so important.
Yeah,
It's easy to get lost in the numbers,
it is.
but we can't forget
Right.
that each data point represents a real person
Yes.
whose life has been impacted
Yes.
by this condition.
It's true.
Their stories are powerful reminders
They are.
of the human cost of long COVID.
And those stories deserve to be heard.
They do.
So when we come back,
Okay.
we'll wrap up this deep dive
Okay.
with some final thoughts
Okay.
and some resources
Great.
for those who want to learn more or get involved.
Sounds good.
So don't go anywhere. We're back for the final part of our deep dive into the world of long COVID.
Hmm?
It's been a journey, hasn't it?
It is.
We started by unpacking those
Yeah.
staggering numbers
Yeah.
on healthcare utilization and costs.
Right.
Then we moved on to those often invisible challenges of navigating a disability claim.
Absolutely.
And through it all, we've seen how long COVID, it's not just a personal health issue,
Right.
but a societal one,
It is.
touching on everything from healthcare systems to how we understand work and disability.
It's true. It really is.
It's like long COVID is holding up a magnifying glass to those cracks in our system,
That is, yeah.
bringing them into sharp focus.
Absolutely. And it makes you wonder,
Yeah.
how are we going to respond to all of this?
Right. Like, what's next?
Will we just try to patch up those cracks?
Yeah.
Or will we actually take this opportunity
Right.
to rebuild stronger,
Yeah.
more equitable systems?
That actually serve everyone.
Yeah, that's the big question.
It is a powerful question.
It is.
So as we wrap up this deep dive,
Okay.
what's the one message you want to leave our listeners with?
You know, I think it really comes down to this.
Okay.
Long COVID is here.
Yeah.
It's here to stay.
It is.
And it's a complex,
Yeah.
multifaceted challenge
Right.
that needs our attention,
Yeah.
but more importantly, our action.
So it's not a spectator sport.
Exactly.
Yeah.
We all have a part to play in this.
And it starts with understanding.
It does.
Understanding the science, the
Yeah.
scope of the problem, the human impact,
Yeah.
and the
The
systems.
systems that need to change.
Yeah. And you know what's really struck me
What's that?
throughout this whole deep dive
Yeah.
is the resilience
The resilience of those living with long COVID.
of those folks. Yeah, they're facing
Here they are.
so many challenges,
Yeah.
yet they continue to advocate for themselves,
They do.
seek answers,
Yeah.
support each other.
It's inspiring.
It really is. It's a powerful message.
It is.
So to our listeners,
Yeah.
we encourage you to keep exploring this topic.
Absolutely.
Share your thoughts and experiences and join that movement,
Yes.
advocating for better research, treatment, and support.
It's so important.
And remember, you're not alone.
You're not.
There are resources available,
There are.
communities of support,
Yes.
and there is hope for a brighter future.
There is. Don't hesitate to reach out, connect, and get involved.
That's a perfect note to end on.